Hi everyone. This year, October is filled with festivals, isn't it? We are just recovering from the Navratri hustle, and before you even know it, Diwali has started to show its presence. But is that all what October is about? I am Dr. Pallavi Kalghatgi, working as a senior IVF consultant and fertility specialist at Zenith Advanced Fertility Center in Pune. And as a fertility specialist, it is my duty to talk about this awareness month. October is Breast Cancer Awareness Month. It is an annual campaign that is held to educate people about breast cancer. Did you know that breast cancer accounts for 27.7% of all newly detected cancers in India? Which means that roughly about one in every one in four women who are newly detected with cancers in India is associated with breast cancer. In fact, also breast cancer accounts for 23.5% of cancer related deaths in India among women. On the screen you can see that if the uh, if the women are divided by age group, about 37.7% of women between the age group of 25 and 49 years are affected by breast cancer, which is actually a very high number. In fact, if breast cancer is diagnosed among women in the younger age groups, the cancer tends to be aggressive, which means that the treatment is also meant to be very methodical. This is why the basic key inform key this is why the key point here is that early detection of breast cancer is very necessary. But can we detect breast cancer early? Yes, definitely. Breast cancer can be detected early, but the basic awareness and knowledge is needed. Awareness about what? Awareness about what your body feels normally. Because if you know what your body is normally, when something abnormal turns up, you will know to take action. And will this early detection make any difference? Definitely, because early detection of breast cancer gives us more options and choices in our treatment and also improves the cure rate. In many studies, it has been shown that early stages of breast cancer actually have a better prognosis and a survival rate, whereas late stages or advanced stages of breast cancer have poor prognosis. Why is this awareness so important? What is the key point that we are trying to focus about in this? There is a very simple saying: what the mind does not know, the eyes cannot see or hands cannot feel. Only if you know what to look for will you find that something is wrong. Now, this statement has been modified a little to, in terms of the hands cannot feel, which means that by understanding your body or being aware of your body, you will know that what to look for. If your body is normally when you look at yourself in the mirror or when you are feeling your breast, if you feel a lump that is suddenly turned up, you will know that something is wrong, which is why women should be aware of certain steps to follow as a general routine for a better health. Women between the ages of 25 to 40 years who have a normal risk. Now, we will talk about the risk factors later, but basically, when I say normal risk, I mean that women who do not carry any hereditary or familial risk factor or the other increased risk factors, which I will be talking about later. So they have to follow certain guidelines. The first and the most important is a clinical breast examination. When I say clinical breast examination, it means that a doctor or a medical practitioner performs this examination. Now, this examination should be done every 1 to 3 years. I understand giving, saying 1 to 3 years is a very vague period, and doing a breast examination every year also seems little, it seems little unwanted. But what I'm trying to specify here is that women who are in the later 30s or early 40s should consider going for a clinical breast examination every year. And women younger than that age group can consider doing this examination every 2 to 3 years. Now, breast awareness. Now, this is a very important topic because this is about you. You know, you can actually do this. It's a self breast examination. Now, a self breast examination is to be done every month by you, by a woman, who usually it is done about 5 to 7 days after your periods, because all of you all must be experiencing some kind of breast heaviness or pain just before you get your periods, and you have some, in fact breast pain is a very critical problem in some women. So this is mainly because of the hormone levels that rise up in the body in the later part of your menstrual cycle. So doing this examination at that time, or doing a self breast examination at that time, becomes difficult. In fact, some of your breast tissue also swells up and becomes and you have there is a lot of water retention, so you may actually end up seeing some kind of swelling, but which is that is misguided because of the hormones. So doing a self breast examination between the first 5 or 7 days of your menstrual cycle is a good idea, and this has to be done every month. So when you do this every month, you know how your body would normally feel like, or how your breast would normally feel like. So automatically you would know if something abnormal shows up. Now, when we are talking about women above the age of 40 years, again with a normal risk, who do not carry any hereditary or familial risk factor, for them, again, the self breast examination is also important. Now, for women who are postmenopausal, who will not get their period, it is ideal to select a particular date in the menstrual in the month to choose to do the self breast examination. So it could be the 5th of every month or the 10th of every month, but basically because there is no menses or menstrual cycle to track, it's better to do it date wise. And the clinical breast examination, that is the examination that is done by the medical practitioner or the doctor, should be done annually. Annually means every year. Now, following that, a mammography is also important. Mammography is usually not advised before the age of 40 years, because women who are below the age of 40 years tend to have more density in their breasts. So small lumps or masses tend to be lost or cannot be detected easily on a mammogram. So, and especially women who are above the age of 40 years, usually 40, 45, their glandular tissue tends to reduce and the fatty tissue tends to increase. So, a mammogram tends to be a much more sensitive test. Again, remember that a mammography should be done after you consult a doctor. So this is how it would go. You would get a clinical breast examination, and if your doctor suggests that you must get a mammogram, you must go ahead and do it. Now, women at any age who carry a high risk have a different set of guidelines. Now, which are these women? Who are these women who have an increased risk? So basically, the high risk factors for any disease, like is have not having a healthy diet, having a very having a rich having a diet that you where it contains a lot of junk food, or where there is more alcohol consumption, or for in smokers or women who are malnourished, they are more prone to any kind of disease in the body. Similarly, but in breast cancer, there are three basic or definitive points which determine that you carry high risk. The first is a positive family history. By this, I mean one or more one or more family member, definitely it should be blood related, who has a history of having breast cancer or ovarian cancer. Now, this can be a little confusing for the for layman, and it is not true that every person who has a direct relative who has had breast cancer or ovarian cancer automatically does not become high risk. So, to determine whether you fall in that category, it is best advised to consult a doctor. Now, when I say doctor, it can be any doctor, but preferably a breast surgeon specialist or an oncologist who has more experience in breast cancer patients. The second very important point is uh, carrying a genetic predisposition. By this, I mean that one or more family member carries a confirmed genetic abnormality in them. Like, so if they have breast cancer or an ovarian cancer, they have been genetically diagnosed to carry a genetic abnormality. So, such people, they who have such relation in their blood relations, have definite high risk towards getting breast cancer. And the third most important point is women who have had previous radiation therapy to the chest wall. Now, if women who have received radiation therapy to the chest wall for any reason do carry a higher risk for developing breast cancer. So, these are the three main points where women are considered at an increased risk of any age to have breast cancer. So, for them, the guidelines are as follows. Basically, again, doing the breast awareness or the self breast examination every month, followed by a clinical breast examination that is to be done annually. Now, this is important because, like I mentioned before, women between the ages of 25 to 40 were not doing an annual checkup, annual clinical breast examination. They were doing it every 2 to 3 months. But when you have these high risk factors, it is important to get it done every month. Following that, a mammography and an MRI is also necessary. Again, both these investigations have to be done only after consulting with your doctor, and if necessary, only then it should be done. Now, how do you perform a self breast examination? It's a very simple thing, but there are a few points to remember. The first important point is you have to do it every month, and it has to be done in the fifth or in the first 5 or the 7 days of your period. The second thing is, first and foremost, you it's a very good idea to look at your breast in the mirror, because you can make out if there is any symmetry or asymmetry. Now, normally, your breasts are never going to be exactly symmetrical. They are going to have some amount of difference between them. One may be more sagging than the other, but because you know your body, if there is any change other than that, it will become more prominent by looking at yourself in the mirror. While palpating your breast or while feeling for a lump, we usually use the first three fingers, the bulb of the first three fingers, for the palpation. Okay, and consider your breasts are circular structures. Now divide them into four quadrants, each of your breast into four quadrants, and using your fingers, you will be moving your breast up and down on the and left and right to feel for a lump in each quadrant. After doing that, and it should not be too much pressure, you shouldn't feel painful, or you shouldn't have any kind of tenderness after doing it. So it should be a very soft touch, but a firm touch. So this is what is going to help us to determine if there is any lump or mass in your breast tissue. Following that, you must also check for any lump, swelling, or mass in your underarm region or on the chest wall, that is the area between your breasts. This examination can be conducted in a standing as well as in the lying down position. Also, a very significant point is this can be done much more easily when you are in the shower, when you're bathing, because you have soap in your hand, and it is the movement that is to be done to feel for a lump can be easier. So basically, what are we looking for in these self breast examinations? Now we are only talking about what we as women can do. So what is it that we have to pay attention to? So definitely having a lump or a knot or a lumpish feel. Now usually our breasts, they feel when you palpate your breast, you will feel that they are soft and your fingers can easily go through or dip into your breast tissue. However, if there is a lump, imagine like a lemon or a tennis ball kind of a texture just below your skin. Or sometimes only you may end up seeing a partial lump. So you are feeling a lump, but it just suddenly disappears at at a certain position, and that is when you feel that there is a lumpish kind of a feel, but you cannot really isolate the lump. Both these sensations or feelings are significant and should be considered as a positive finding. The next important, sometimes what happens is when you have a lump, so especially this is seen in women who have more or who are heavier in the breast, you may not exactly feel a lump externally, but if the lump is deep seated, what it does is that it pulls the nipple inside. So you will see that your nipple is a little dipped or it's a little retracted or its shape has changed a bit. That is again a very important point. Sometimes you may experience that there is some kind of discharge from your nipple. This could be blood stained, this could be milky, this could be mixed colored, it could be pus like. Whatever discharge it may be, it has to be evaluated, and that is also an important finding. Now, normally, if you pinch your breast tissue, it comes in your hand easily. But if the skin over your breast area is thickened, or it shows some kind of discoloration and it is thickened, it won't come in between your fingers easily, and that is again called thickening of the skin, and that is a significant finding that has to be evaluated. And like I spoke about, there if you see any lumps in your armpit or your chest area, that is also a significant finding. Now, any of these findings, if they turn up, they need to be evaluated. But it does not mean that you have breast cancer. You could have a benign cyst, you could have a benign tumor, it could be n number of things, because every time you find a lump, it does not mean that you have cancer, but it does mean that it has to be evaluated. Because if even if there is a cyst or even if there is a lump that is non-cancerous, they have to be maintained, they have to be checked and followed up on. So that is why it is important to get yourself checked and evaluated immediately when you find such findings. Okay, so now say that on a self-breast examination or while taking a bath, you feel a lump or you feel a nipple discharge or you feel pain or you feel any of the symptoms that I just mentioned. What are you going to do next? Visit a doctor, definitely. But I'm sure most of you are confused as to whom should you visit, which is the kind of doctor I should visit. So your initial stage, you can visit any, if you're confused, visit any doctor. You can visit your family physician, you can visit a general surgeon, you can even visit your gynecologist who can perform the clinical breast examination. If at all the doctor you have visited initially feels that you need to be referred to a higher specialist or an onco surgeon or a breast surgeon specialist, they will do so. And moving on, the specialist doctor will perform certain examinations, will confirm the findings that you found, and after that, some amount of confirmatory tests will be done. These confirmatory tests usually involve a biopsy, basically trying to confirm a malignancy is done at a cellular level. So, a part of the growth or the lump is usually collected and examined under a microscope and is checked for any cancer cells. After this confirmation, whether it is malignant or benign, staging is done and the patient is thoroughly counseled and a treatment plan is decided with your surgical oncologist. So, this is how it goes, and every step is very, very crucial because imagine you have found a lump but you do nothing about it and you just want to see if it grows in the next 1 year or 2 years. And if you decide to wait on your own without consulting a doctor, that just gives it more time to grow probably. So each step is crucial. The moment you find something abnormal, you must go and visit a doctor. Now we have spoken about the monthly self breast examinations, but what are some other simple tips that you as a woman can follow to have a healthy lifestyle and to basically prevent the body from creating abnormal cells, because that is what cancer is, right? So some healthy tips are exercising regularly. Definitely following a healthy exercise routine is important, that maintains your blood supply, that gives out good hormones, and overall it has a very good effect on the body. Keeping your alcohol consumption to a low, because of course we all know alcohol is not, when consumed in excess, is never good. Smoking is never good. Smoking creates a lot of oxidative stress in the body, which can be harmful. So definitely smoking, stop smoking. The next important point is wearing a properly fitted bra. This definitely goes without saying, but what happens is that especially women who are on the heavier side, if they do not have well supported breasts, you may tend to have a growth. Especially you may tend to have a growth. This is difficult to find. So that is why wearing a properly supported or fitted bra is very important. Receiving regular mammograms, I've already spoken about that. Maintaining a safe weight and avoiding obesity, very important. And of course, having a balanced diet. When I say balanced diet, I mean eating a lot of fruits, vegetables, high fiber fruits, high fiber foods. All this because seasonal fruits, vegetables, all of them have natural antioxidants, which will actually prevent your body from creating something abnormal. It is also a very good idea to get regularly checked on your vitamin levels, because they do play an important role in the general metabolism of the body. So, getting your vitamin levels checked and corrected is also a very important step to prevent breast cancer and any disease for that matter. So, these were some basic points about how to live healthier and how to basically. It is mainly in connection with the campaign that I was talking about of Breast Cancer Awareness Month. We do not spend a lot of time thinking about this, so this is just our way, as Zenith and its team, our way to spread some knowledge to all the young women out there, that be more aware of yourself and your body. The more you understand how your body is responding, the more you know that when something is wrong. So this is just our little way of telling you the importance of this month and taking control of your body. I hope this was an informative topic, and you all of y'all are free to connect with us through any of our social media platforms or our number directly, where you can, if at all you have any questions, any queries, you want to get yourself examined, you can come and I mean, we can help you and try and help you understand if at all needed. Thank you so much, and hope all of you have a lovely weekend ahead, and take care. See you.